In today's episode, we're going to be talking about propranolol. This medication has been around for a long time. It was first patented in the 1960s, and we have discovered many applications for it throughout the years. It is a member of the class of drugs known as beta blockers, which are a class of drugs that target different bodily parts, such as the heart and blood arteries. They aid in the relaxation of blood vessels and lower the heart's frequency and intensity of beating. It can assist in a plethora of ways thanks to these various methods. We'll discuss some of those typical uses first, and then we'll discuss the medication's adverse effects and other things you should be aware of. The cardiovascular or heart system was the first organ system for which propranolol was initially intended to provide assistance. It is used to treat disorders including atrial fibrillation, which causes irregular heartbeats and high blood pressure. It can be used to treat specific types of chest pain brought on by heart disease, as well as to help stop more damage before or during a heart attack, as well as to stop more episodes after a heart attack. This medicine helps the heart work less hard by slowing down some of the stimuli that go to the heart and blood vessels, which allows the blood vessels to relax. Numerous preventive effects on certain illnesses may result from this. We don't use them as frequently as we used to since there are many other medications that are now available that are a little better for certain diseases, but they can still be a good choice in some circumstances. However, the same result also applies to another illness for which we prescribe this drug: the treatment of esophageal varices, or dilatation of the esophageal blood vessels. They essentially resemble varicose veins in the throat and appear when a person has liver problems, most frequently cirrhosis, which causes the liver to scar and become less effective at filtering blood. As a result, the primary vein supplying the liver has a blood clot and pressure rise. These blood arteries enlarge as that backs up, and if things get too severe, they may burst. Initially, propranolol was primarily used to treat these kinds of heart and blood vessel problems, but as time has gone on, we've discovered that it can also be used to treat a number of other conditions. In fact, we tend to take this drug more frequently for certain illnesses. Now, treating specific forms of anxiety is one of the most frequent uses for this. It appears to work best for people who have severe anxiety when speaking in front of an audience. Like any medicine, it is not helpful for everyone, but many people find that taking a little amount approximately an hour before a stressful event, like public speaking, works extremely well for them. All it does is sufficiently reduce heart rate and shaking to assist someone in getting through it. It is definitely worth a try for people whose anxiety appears to manifest with a little more racing heart rate, shivering, and feeling on edge, since we do use it periodically for general anxiety-type symptoms as well. Now, benign essential tremor is the next condition for which it is used. This is a condition that seems to worsen with age, or we may experience a tremor that shakes, especially when we try to write or grip objects. It's not associated with diseases such as Parkinson's, but it can be highly irritating. We now use it to stop migraines from happening frequently. We believe that cerebral blood vessel spasms may be one of the causes of migraines. Propranolol may be able to help some patients avoid these spasms and lessen the frequency and intensity of headaches. I'll wrap up with discussing a disease known as hyperthyroidism. This is the condition in which the thyroid is overproducing for unknown reasons. When it does, it can lead to a number of issues, including an extremely fast heartbeat and an agitated feeling. As you can see, we didn't even cover all of the various problems or applications for this drug. However, the risks and side effects associated with this drug are the same regardless of the reason you are taking it. Now let's discuss a few of those. The most frequent problems with this medicine are associated with its effects on blood pressure and the heart. The main caution I provide patients using this drug is that it might be overly effective. It is possible for your heart rate to drop or for your blood pressure to drop. Asthmatics are yet another category of persons who should use caution when using propranolol. As a beta blocker, this drug may have an adverse effect on certain lung receptors and exacerbate asthma symptoms. Additionally, it may negate the effects of several asthma medications and reduce their efficacy. Therefore, if you take this drug for asthma, you should work very closely with your doctor. Aside from those, other side effects include nausea, diarrhea, tiredness, sleeplessness, and sometimes even impotence. Most of the time, these symptoms are transient and disappear within a few weeks, or they can be made better with a simple dosage adjustment. A fact, some people may experience certain serious symptoms constantly. Therefore, discuss any concerns you're having with your doctor if you're experiencing a lot of side effects from your medicine, and find out what advice they have to offer. More serious effects can now include deteriorating heart failure, an extremely low heart rate, exacerbation of asthma symptoms, allergic reactions, blood count abnormalities, and exacerbation of Raynaud's-like symptoms, which cause your hands to turn cold, white, or blue and hurt when they come in contact with the cold. There is a warning label attached to propranolol called a black box. This is a particular warning regarding a potentially serious side effect of a medicine. Propranolol's black box warning cautions about quitting the drug suddenly in people who already have heart disease. Even if this isn't a typical issue, it's nonetheless vital to be aware of. Most patients who have serious underlying cardiac disease are affected by this, and most of them are aware that they fall into this category. However, it is possible that you are unaware of this underlying illness. We simply advise anyone using it to taper off of it gradually as a result. And there you have it, folks. That's our deep dive into propranolol. I hope you found this video informative and helpful. Remember, this is just a starting point, and if you have any specific questions or concerns, consult with your healthcare professional. If you enjoyed this video or found it useful, give it a thumbs up and share it with anyone who might benefit. Don't forget to subscribe for more insightful content. Thanks for watching, and I'll see you in the next video. Well, maybe this knowledge was useful to you. If so, kindly take a moment to like and share this video with your friends. It facilitates the expansion of our channel and allows us to contact more people who might require this. In order to ensure that you don't miss any of our upcoming content, please make sure to hit the notification button and subscribe if you haven't already.